Good. Welcome and thank you for joining us today for the meeting of the New York City Health and Hospitals Strategic Planning Committee. Today's meeting is officially called to order. Quorum has been established. I'd like to call a motion to adopt the minutes of the Strategic Planning Committee meeting held on April 11th, 2022. I will poll our members. Dr. Martone?
Yes.
Thank you. Frida Wang? Yes, she said yes. I can see Sally.
Yes.
And I say yes. So we're set.
Penny also say yes.
Oh, Penny, I'm
yes,
sorry, you're not on my list, but thank you. I'm delighted. Okay. Thank you.
Okay.
Is there anyone else I'm missing, Colicia? No. Okay. Okay, we now have an action item to consider for presentation to the board. Deb Brown, could you please read the resolution into the record and proceed with the presentation?
Sure. Adopting in the name of New York City Health and Hospitals Corporation Board of Directors, the 12 community health needs assessments prepared for each of NYC Health and Hospitals' 10 acute care hospitals over 11 campuses, and for the Henry J. Carter Specialty Hospital and Rehabilitation Center. Shall I read the whole thing? That's it. Okay. Hello, everyone. Thank you very much for having us here today. Though I am doing the presentation, I am speaking on behalf of quite an extensive team, primarily led by Okenfe Labardi to my left, our Senior Director for Community Affairs. I want to thank him, Chris Philippou, Wilbur Yen, our DNA team, our communications team, the board office, and many members of the board. I could go on and on, but this is very much an enterprise by a village. So first slide, just to remind you, it is an IRS requirement that each hospital, each nonprofit hospital, perform a community health needs assessment every 3 years. We here at Health and Hospitals take this very seriously. It is part and parcel of the work that we do. You will see in this slide an explanation of the requirements for it, and just in those two middle and last columns, clarification that it's really a two-part process. First is the development of the community health needs assessment, in which we define the community itself. We define what the community needs are using inputs from a wide variety of sources. And the second, which is to be coming, is the implementation strategy, where we take these needs and talk about what that's going to mean in practical terms. So what you're thinking about today and what we will be reviewing and you will be voting on is that middle part, the community health needs assessment itself. That's where we are. Just as a bit of process, I do want to acknowledge we are in the midst of finalizing the actual document with the printer and with the designer. So that will certainly be ready for you by the time of the full board meeting. But I do want to note that the book itself is not prepared, though it's a matter of tweaking at this point. So on to the next slide, please. So a requirement of the needs assessment is that you bring in as many perspectives as possible to really talk about the needs of the system, the community that the system serves. We really endeavored to dig in on that this year, and I think we have been successful. You will see that we did 32 expert interviews with leaders. That includes many of you, our colleagues at DOHMH. We added for the first time 12 community forums at each of our sites. Previously, our needs assessment had not incorporated the existing structure of our community advisory boards, our CABs. So we sort of turbocharged them and did meetings, a variety of meetings with them, as well as other parties. Each of the facilities, of course, was involved. We added 5 borough-wide focus groups so we could bring in the CBOs, many of the parties that serve our communities that are not per se healthcare providers. We also developed for the first time a community health needs advisory board, trying to sort of wrap up folks who might not have been caught otherwise. And one of our expectations and hope for that is that this will be an ongoing body. We very much, and again, I'm speaking for Kenfe and the team and myself, expect that this will be something that continues to meet in a practical way, certainly through the development of the implementation plan, but thereafter as well. It is our hope that in 3 years' time, we are not reconvening, not recreating this wheel for the first time in order to do the CHNA. On the quantitative side, we did a written survey. We this year got 10 times as many responses has been done previously. And again, that is a great credit to Akenfe. Some of you have heard me say he first came to me and said he wanted 2,400. I said, oh, that's really nice. Good luck with that. And he blew past that. So that's very exciting. And I have to thank our communications colleagues. They ensured that it could be sent out to our patient database. And we also had it posted in a variety of places, in English and Spanish, so that we could get as many responses as possible. And that, of course, is in keeping with the requirements of the CHNA, which say we need to be representing the broad interests of the community. Next slide, please. Won't stick on this, but that's just an overview of some of our focus group participants. Both CBOs, some businesses, press, as many, frankly, as wanted to participate. We were delighted to have them. Next slide. So as I said, the data we collected was both quantitative and qualitative. So this is just sort of an overview of the top responses that we got. They're broken down a little bit more finite, but I will say kind of the overall buckets are really not about health as much as kind of the underlying causes, and that's to be expected. We're talking about economic status, mental health and well-being, violence and sort of safety in the community. And then, of course, COVID, although it's interesting to see, COVID is lower down on the list than one might expect. Next slide. And then we married that with qualitative research, and this is just sort of an overview. Fenny, you said something that we really took to heart at our last discussion. We need to make sure that we are both hearing and listening and hearing. And so we just wanted these slides to reflect that we really hope we did just that. And we sort of identified two big buckets. One is, health equity and chronic disease, no small thing. The next one, as you will see, is facilitating access to services. It is not surprising that our community members are very facile in identifying their concerns, in identifying the things they have and they do not have, and also in identifying, it's interesting, the populations. And you see that in that sort of gray box, where they sort of called out specific populations that they themselves were worried about. So that you'll see in the report. We can go through that. And the next slide, as I said, is more about facilitating access to services. So these are things in the community that people need and or want. And very many of them are not about the delivery of healthcare per se. They are about the underlying causes that might get to health. Next slide, please. It would be impossible to do this exercise without talking about COVID-19, but some of you have heard me say before, we wanted to be really responsible and not make it just a report about COVID-19, because of course, even in the midst of that, we need to keep serving our communities. You see it as a driver of community health. First of all, the immediate impact of health needs as well as long COVID, and then again, going to some of those underlying causes, behavioral health, wellness, the influence on economic and social needs. A lot of the qualitative discusses people losing their jobs, people even leaving their homes during COVID. And we need to honor that, but we also need to balance that with the fact that, the system continues by necessity to do that much more work. Next slide, please. And this is just sort of an overview of, what you'll see in the book. We tried to highlight where in the city we had the most COVID visits, the most COVID services. Might be kind of hard to tell there, but we really wanted to reinforce that, of course, our individual facilities serve communities, but we are responsible for the entire city. Okay, next slide. So next steps, I guess what I should say is, we need to get the glossy book back from the printer, and that's, we're in the process of that. That is to be disseminated, and we disseminate that by sharing with you, by putting it on our website, by making it publicly available. And then we will go into the process of implementation planning, and that's using, again, those resources that we have identified, pulling in others where maybe we didn't get them last time through October, going through that process, and then we'll be back to you in November with the implementation plan. And then, as I said, we want this to be ongoing. We want to continue to evaluate and monitor as we go, and that's why we're doing this within the context of the Strategic Planning Committee, because it marries to so many of our strategic priorities. Okay. If we could go, in the appendix, we present kind of screenshots or pages from the actual document. It's about, 110 pages now, so clearly...
116.
116. So clearly we're not going to give you the whole thing, but we just wanted to kind of give you an overview of the setup. We kind of start first actually with an explanation of H&H, who we are, talk about the priority needs. Sorry, next page. Oh, yeah. I'm sorry. Can you go back one? I apologize. I got ahead of myself. Give an introduction, talk about, those kind of two big buckets, equity and then services, and then go through and really give an explanation of how we gathered the information, what the information is, who provided it. So sorry, next. And then next. And then these are kind of some pretty mock-ups of what it'll look like after we do that big section. Then we go borough by borough, and then from there facility by facility. So I don't know if you can see this, but this is what the entry page for Queens will look like. And then for each facility, it shows a map of where they get their most patients visits by zip code. It talks about some facts and figures about the facility. Give some breakdowns on the patients who are served. And then next slide. Then there's kind of a spread on more of the qualitative, that which people had to say. There's a review of COVID. And then next, thanks. You'll see, we do this for each one of them. These are just examples, Bronx and then Jacoby. Next, please. Yeah. Okay, and then, right, and then just to give you a little bit more of a close-up for each of them, for each of the 12 facilities, there's this kind of drill down on it. So we're really excited. We are working frantically, but it's great stuff. And, again, I can't thank this expansive team enough, the facilities, the board, and the community members. They're really, one of the things that was heartening to see is that we really tried to not make this an evaluation of H&H, right? We really tried to gather information. It was heartening to see how many times kind of spontaneously came up the fact that H&H, or the particular facility in the community is an asset, for COVID and otherwise. And, I think certainly our CEOs and our teams at the facilities should be very proud of that. And then, sorry, the last appendix, just, we wanted to harken back to the last CHNA, and just, what we do in the book is give an overview of the steps that have been taken to meet those identified needs. And at the time, I guess those buckets were, actually pretty similar. They talked about the burden of lifestyle and lifestyle-driven illnesses, and then redesigning healthcare for communities. And so next, we just give sort of for each of those kind of high level, but sorry, next, details on the steps that the system has taken in order to address those priorities. And I will say, in the middle of COVID, I think that, there was some concern when we started this that it would just, as I said, be the COVID show, and that we wouldn't have much else to talk about. And it was really pretty inspiring to see how much work has been done since then. So again, thank you. I'm happy to answer any questions.
Thank you for such an enthusiastic report, and congratulations to you and all the people who put in work to it. Let me poll board members to see if they have any questions, starting with you, Dr. Martone.
No, thank you.
Thank you. Sally?
This is like one of my favorite projects of the year. It takes an enormous amount of work, but it affords us an opportunity to continue to reflect on the needs of our community and to have an opportunity to reflect on what we're doing to help address some of the issues that they have raised. I loved looking at Appendix B and seeing everything we did in response to the last report. So I know it's a lot of work, but it's a live document. It's one that speaks to you throughout the year, and I very much appreciate the work you do.
Thank you, Sally. Likewise.
Thank you, Sally. Benny?
Okay, I don't have any questions. Thank you.
Thank you. Frida?
Thank you. No questions, but also just want to thank you and congratulate Deb, you and the entire huge team that did this, because I agree with Sally. It is just a great document to understand the impact we're having, the needs we have in our communities, and making sure we address those and all the work we're doing. Thank you.
Thank you.
Well, great. So with that, I'm going to ask us to vote, and I'll call on each of you for your vote. Dr. Martone?
Yes.
Thank you. Frida?
Yes.
Sally?
Yes.
Benny?
Yes.
Very good. Then we've passed the report. Thank you again, Deb, and to all of the great people who worked on it. And now you're going to be joined by Matt Siegler and Eric Way on an update for the system dashboard.
Thanks so much, Dr. Katz. Good to be with you all. My voice is projecting on the speakers in our beautiful new boardroom here. Great to be with you. I'll give Deb one more second to breathe after that great presentation, but we're going to have a policy update on the federal, state, and city developments on the policy level, and then we have an excellent strategic dashboard update for the third quarter of fiscal year 2022. But first, Deb, on the policy side.
Thank you, Matt. Yes, so, as ever, it is an exciting or perhaps exhilarating, perhaps confounding time. Just real quickly to work through the three levels of government. Obviously, a great deal is happening at the federal level. We are, waiting for some opinions to come out from the Supreme Court, and those have an impact on policy and operational issues on the federal level, on the state level, and on the local level. Just now, I believe the governor is signing a package of abortion-related bills, which do many things in addition give protections to our providers. And so, though we start with that in the federal bucket, it really is an issue that is going to be dribbling down. On the federal side, I think it's no secret there continue to be legislative challenges. Interestingly, there was a skeletal deal announced this weekend, as many of you saw, I'm sure, on gun violence, which again, though not in theory something that relates to hospitals, of course it relates to hospitals every single day. I don't even want to say the devil is in the details. The devil is in the getting pen to paper now. Matt is nodding. I am nodding. Anyone who has ever done legislative drafting knows, there's much work to do, but it is at least a welcome first step. On both the federal and the state level, we're thinking a lot about the impact of redistricting. There is just kind of ongoing, I don't want to say chaos, but ongoing chaos regarding the lines. What I will say is, regardless of what happens, we at H&H are very comfortable and very grateful for the support we have gotten from our congressional delegation. I think we've been able to build some really nice relationships with them, with their staff. They do a great deal for us financially and policy-wise. We are very, very grateful. And then just, there's ongoing regulatory work. We're working on responses to the big IPPS proposed rule, which is about funding for next year. Matt had mentioned previously working to solidify our relationships with some of the leadership at CMS. On the state level, we got to the end of the legislative session. My colleague, my team member, Michelle DeBacco, of course, did a Herculean job. This was more bills introduced and I believe passed than, at any time in the history of Albany, or, it's extraordinary how much work was done this year. Michelle is working on a monster, or is about to circulate a monster chart of all of the bills, because again, there's much in there that might not ostensibly touch us, but very much touch us. And you will see from now until December sort of doled out process by which the governor takes the bills that have passed both houses and signs them. We've got upcoming primaries. The state has been working on, and we with them, the request for the 1115 waiver, which is extremely important to the future of the Medicaid program, extremely important to us. You've heard us talk about that here. That's something that is going to continue to keep us very busy. And then finally, on the city level, just this weekend, or I guess on Friday, reached a city budget agreement. Just before the meeting started, I was poring over the shoulder of James Cassidy, our director of finance, who is at the table, to look at some of the individual appropriations that came out. And we have a whole slew of upcoming council hearings. I suppose, now that the budget is done, we've got about 4 or 5 lined up in the next 2 weeks. So no shortage of work here, and we will obviously be there advocating for our communities.
Great. Thanks, Deb. Never a dull moment, and very important progress on all fronts. On our system dashboard for this quarter, we are looking at January 1st through March 31st of 2022. As the board will remember, those early weeks, especially of January, but really into February, was the height of the Omicron surge in our facilities and across the city. So I think that is a major driver of a few of the negative measures here and a few of the positive measures as well. But really an outstanding report, I think, overall on how folks were able to maintain operations and continue driving forward our strategic goals, even in the face of that enormous challenge. So jumping forward to this slide, our post-acute hospitalization rate stayed largely steady and even dipped a little bit, which again, I think a great accomplishment given the importance of protecting our seniors and vulnerable populations from Omicron, to have the number of hospitalizations or the rate of hospitalization not rise during that period. So a tremendous accomplishment. Similarly, the follow-up for our behavioral health patients after an admission and a discharge from our facilities jumped up above 50%, the first time above target, which is a great result. And again, a tremendous accomplishment in the face of everything else that was going on during this period. Our percentage of patients leaving the ED without being seen, that dipped as well. The result of a lot of performance improvement work by Dr. Wei and his team, but also potentially the result of some of the impact of the Omicron surge, with folks staying away from the facilities unless they are in more serious need. So we'll continue to watch that one and drive it forward. On the next slide, our financial counselors and ambulatory care teams continue to make very important progress on helping our uninsured patients enroll in health insurance coverage or financial assistance. The success rate there has crept up above to 87%, which is exceeding what we thought was a very ambitious target of 76%. So we will look at that target again and see how high we can go with that one. It's a great indication that we're connecting with our patients early and often and helping them enroll in all the benefits they're entitled to. I think Sally in particular, our chair of the Metro Plus board, will appreciate this one. This next number, our partnership with Metro Plus is deepening, and the percentage of their medical expenditures at health and hospitals jumped up to 42.5% this quarter. Potentially a result of some of the Omicron utilization, but still, I think the result of steady and sustained partnership between the two organizations, which is great, or the two parts of the one organization, I should say, in keeping with the mission of it. So that's excellent. On AR days, our accounts receivable days, again, creeping back down towards our target. Lower is better here, so we are down from 60 to 53, which we're pleased about. And our enterprise data center migration process, one of our two very large information technology projects that we track in this dashboard, is at 38% of total completion, and all of the Q3 milestones were met last quarter, so a great result for that team as well. Continuing on to the next slide, to other positive trends. Our number of e-consults remained above target and jumped above 100,000 for the quarter. I believe this is for the first time above 100,000. That's a great result of some of our ambulatory care 2.0 work and the move to expand access to specialty care, so we will continue to advance that one. Pleased to see it. And then our culture of safety, we had over 1,100 wellness encounters in this quarter. Now, this is a positive one because we're always pleased to see our staff reaching out for help when they need it, and honored and proud to be there for our staff when they do need it. Of course, when a number like this jumps up as much as it did, I think it is a result of the stress and strain that all of our teams were under during the Omicron surge. So mixed feelings about it being up, but glad that we are tracking it and there for our teams. On the next slide, steady trends, those that are close to or exceeding target, but did not rise or fall too much. Enrollment in NYC Care drifted down a bit to 110,000. It remains above the target, but graduations from the program, folks able to enroll in health insurance coverage rather than NYC Cares, their eligibility increases, I think are the result of that relatively modest change. The next slide, MyChart activations. We have been creeping towards our target of 75% and remaining in about the 71, 72, 73% range. And we are staying steady there. So we have to find another way to get that number back up. But I think the focus on this will start to shift towards the utilization and the engagement with MyChart rather than just enrollment. We've had great engagement, but I think that is the key area we could do better. When you have 70+% of 1.2 million patients around the system on this patient portal, it really falls to us to make sure they're using it actively and that we are connecting with them through it. So that will be a focus going forward as well. And then steady on a couple other key financial sustainability measures. The percentage of patient care revenue over expenses staying at 74.8%, and then our post-acute accounts receivable days above where it was last quarter, so not a great result, but still below the target of 50 days. And then finally, on a couple of negative trends, our diabetes control measure did drop a little bit from 66% down to 65%, and our access to care, the number of primary care patients, dipped down to around 400,000 in the quarter. I think both of these line up with what was happening due to Omicron, with the reduction in our ambulatory care schedules, the redeployments of some staff. And so these are critical ones that we hope to see and expect to see bounce back in the coming quarter as we've reopened fully for ambulatory care and are welcoming patients back in person for visits. Next, I think two other measures of patient satisfaction and their rating of care experience that dipped both on the inpatient and ambulatory care side. I think, again, I would ascribe these largely to the Omicron experience. The access challenges were severe at times during that period, and then, with the heightened census that we had and the challenges that our staff were under, it is disappointing, but not unexpected to see these measures dip a little bit in that quarter. So we will continue to push for them to improve as we come out of, hopefully, our last major COVID surge. But I always knock on wood many, many times when I say something like that. So those are our performance measures. I think just a tremendous result overall, given everything that was going on around the system. And I'll just keep going and then pause for questions at the end. on our racial and social equity measures, we'll be reporting the percentage of total procurement spend on MWBE at the end of the fiscal year. A tremendous amount of progress by our supply chain and other teams on that. And then on the percentage of new physician hires from underrepresented minorities, we are continuing to try to get better reporting on this from our affiliate partners. There is a lot to be done there, but the results from the prior quarter were 43% women and 8.8% African American, 3.5% Black or African American, 8.8% Asian, and then 1.1% Hispanic or Latino. Finally, you have our COVID measures. The number of tests administered declined, and the number of positive tests increased, and the infection rate increased significantly in this quarter. So again, this was the height of the Omicron surge. Interestingly, the vaccine administered dipped quite a bit, in part because there was, as folks will call that rush towards testing and vaccination right around Christmas and the holidays, which was important to be there. And then finally at the bottom, seeing the turnaround time for these test results stay low and decline was really excellent to see that service is staying in very strong shape. And so finally, again, I think a lot of green on this report. Great to see that, and then hoping that the red items turn to green as we move past this Omicron surge. In our next quarterly update, I think we'll start to talk to the board about some updates to some of these measures. We've exceeded many of the targets pretty consistently, and so what that says to us and Dr. Katz's leadership is set higher targets. And so I think we will continue to push ourselves and our teams to do that, and appreciate the board's leadership and happy to take any questions.
Well, thanks, Matt, for that report. Much appreciated. Let me ask the board members if they have questions they'd like to ask Dr. Martone.
No questions, thank you.
Thank you. Frida?
Thanks. Thank you, Matt and Deb, for a great report, as always. I love all the data that we're keeping track of here. It's terrific. I have a couple of questions just on NYC Care. The decrease slightly from 1 to 110 from 114. That's just the number of people we have enrolled in NYC Care, right? It's not like new enrollees.
Correct.
And so I think what you go ahead.
No, correct. It's the total number of enrollees. Yes.
Right. And what you mentioned, I think, was that some of that is just due to people getting onto other programs, and I think you use the term graduating out. And do we have any tracking or record of what happens to that decline in enrollment? Are we able to see?
We are able to track some of it if it happens in our system or through one of our financial counselors. But I think other than that, there may be some survey response information, but I don't think we have granular detail on every single person. But I can speak to the team and see if they have any more granularity on how that's split.
Right. I just, clearly it's above where we want to be, so it's still terrific and doing what we want it to do. But I'm just curious to see if there's something else going on, if that trend continues to climb.
Yep, we'll look into it. And I think as certain policy changes at the state level around people's eligibility for programs becomes more fixed, we may see that number shift, and we may look at what our targets for the program are. But yes, we'll talk to Jonathan and Ted and the team and see if we can get more granularity on how those members are moving around.
Okay, thank you. Then on the My Chart activations, I think you mentioned this as well, maybe starting to look at utilization as opposed to activation. Is that something that we're able to track now, or are you something you are tracking?
Yep, we definitely track it in a few different ways. The kind of key measure we've been tracking is the speed of response time when someone sends a message to their provider. If you look at kind of the the single biggest measure of whether a person is engaging with it. It's whether they're able to talk to their care team. So we want as many of those responses as possible within 48 or 72 hours at the most. So we have some room to improve upon that one. It's about I think 50 or 60% within that time period, and that should be up higher around 80, even 100%. So we'll work further with Ted and Andrew and the team on what's reasonable in the near term. Part of it is about staffing up the surrounding care team so that it's not an individual doctor's responsibility to respond to every single message that comes in, and we've got work to do there. That's a key one. The others that we track are just the number of messages that people send, how frequently people open and engage with the app, the financial counseling that's done through MyChart, how many people pre-register through the app before they come in for a visit. So there's a number of different ones we check, but that one about care team response time is the one that we've been focusing on most with our facilities, with our physician affiliates, and with our ambulatory care leadership. So that may be one we bring forward as a measure to show to the board, but certainly keeping this one on and keeping the activations up. I'd hate to keep dipping, too much further down, so we will keep a focus on that, but engagement is definitely a priority as well.
Right, because I think some of, and we talked about this before, been a lot of activation perhaps just from all of the testing and that was happening because of the virus. But so I can see that measure might, be stabilizing a little bit or slowing down. And what is that telling us? And so having some of the other context is very interesting too.
Absolutely, absolutely. Yes, I will say my favorite statistic, and the one that did surprise me though, is that we have higher rates of activation for our patients who are enrolled in primary care than we do for just people who have come in for testing or vaccinations. So it certainly raises the overall number, but the percentage is higher when people are engaged with us, which is exactly what you'd want, right? They're connected to us. They're staying part of the system. So that's very great to see. But we have to keep the number up. We've been so successful that staying up there is a test.
It's hard, yeah. Right. Well, that is great. A great statistic about the primary care patients. One last question was on, I guess, care experience. The declines, just, we are below target. Is that, I don't remember, I'm sorry, from, prior quarters. Is this a trend that you're seeing continue, or is it kind of up and down in different quarters? Or are we taking a look at how that's moving?
It has tracked, I'd say, most closely to COVID surges, unfortunately, right? It dips during COVID surges when there is, much less in-person ambulatory care, when there are, a significantly higher census and strained staffing ratios, the satisfaction goes down. We've seen that consistently over the last 2.5 years. So that part is a real challenge and hopefully one we are past. But beyond that, we have seen, I'd say, slow and steady progress in the kind of non-COVID surge quarters. And it's a variety of interventions, everything from our eye care training around the system to just the staff satisfaction measures to everything down to cleanliness and facilities development, right? All these things come together, so it's one of these most multifactorial and team effort exercises, but particularly Dr. Wei and his team focus on it, track results and surveys down at the unit level and the practice level. And so we have a lot of good feedback loops to try to help all of our teams improve those. And hopefully if we are past those most acute COVID surges, we can get back on that track of faster and steadier improvement.
Great. Thank you.
Of course.
Thank you for the extra context.
Very good. Thank you, Frida. Sally, any comments or questions?
Yeah, just two things. First, Rita, at the QAPI meetings, I've been following the hospital's reports on the response time on my care. I just follow it by listening to it. There's been a lot of creativity employed to ensure that the doctor's time is well used in responding to things that they really need to be responding to, but also that a patient gets heard when they do flag an issue through my chart. Somebody, responds to it. So I think it's an issue that's at the forefront of the hospital's minds as they're moving forward with this.
That's great. Thank you, Sally.
Sure. Secondly, Matt, I just wanted to say that I think the wellness encounters sometimes indicate that there's an issue or trauma that we're dealing with. But I think sometimes it just indicates that, or hopefully it's indicating now, that it's embedded in the culture, and that even in the absence of traumatic experiences, thought is being given to how well we're dealing with stressors. So, for example, I think it was McKinney at one of the POPI meetings had a 3-day retreat with senior management and a bunch of other people to discuss, how staff is feeling, how staff is doing. It wasn't around an issue per se. So I think that, that's huge kudos to Eric for just, cementing this into the system now.
Absolutely, totally agree, and I hope it stays elevated, right? I think it would be a great result if this was not just because of the stressors of Omicron, and we kept the number growing as you say.
Yes, that was it. Thank you.
Thank you.
Okay, thank you, Sally. Fenny, any comments or questions?
Yeah, thank you, Dr. Katz. Again, Matt and the team, thank you for, your work on the strategic measures and keeping track and updating. I think this is an impressive undertaking, and it provides a really strong foundation to look at what is going to be the next 5 years, if you think about it, knowing what we know about our strengths, and how we exercise that strength during the COVID pandemic and the great work that has happened in the system. I think this is going to be great. So I'm looking forward to start thinking at the end of this year on the update of the strategic plan for the next 5 years. So thank you to you and your team for such a great work.
Thank you.
Okay, are there any other comments that people would like to make? All right, is there any old business? New business? Okay, there being no further discussion, our meeting is adjourned. Thanks, everybody. Very good meeting, very good morning. Thank you to Alicia and all of our IT staff for making these virtual meetings a success. We much appreciate it. Thank you, everybody.
Thank you.
Thank you, everyone. Bye-bye. Bye.
Thank you,
Bye.
everyone. Be well.
This meeting is no longer being recorded.